Hello, we'll be looking at 4 simple exercises to help prevent carpal tunnel syndrome. We'll be addressing the wrist, the palm, the fingers, and the thumb. Let's begin. Each of them will be for about 20 seconds. First, the always popular and ever useful wrist extender. On the wrist extender, the palm stays flat as much as possible, and we decrease the angle from the top of the hand to the back of the forearm, letting these wrist tendon muscles extend, giving them some relief. And then switch sides, and about 20 seconds on this side as well, setting the thumb open, letting the fingers spread, the wrist drops down, just bringing the body back to where you barely start to feel it. And then on the same side, you can now do the finger tendon extenders. So it's the same idea in terms of giving relief to the tendons, but the fulcrum now is where the fingers meet the palm. Same idea of stepping back, letting the tendons in this part of the hard-working fingers get some relief, and then switching sides and lining up the palm area, almost touching the surface, sliding back a little bit. Everyone will find a different place where they'll meet resistance with this. And then the next, the ever popular, the thumb alignment. You can just drop your hand in front of you, take your fingers, and pull that bone of the thumb that comes in and attaches to the wrist, rotate that. And we talked about the tendency for the bones to shift together. This is how we're going to pull that open. Very simple position, and then switching sides again. For about 20 minutes, the thumb wants to, 20 seconds, the thumb wants to creep in, let it extend out, and also find that rotation. Wherever you start, you should be able to move it somewhere. And then finally, I'd like to do an exercise which I think of as big hands, merely extending the fingers and the hands. Remember the importance of the webbing. When the webbing starts to pull together, there becomes calcification. So this idea of big hands, extending the fingers often is very useful. And finally, wrist release. Shake out the wrist, move the joint, stimulate circulation. This should feel comfortable. And that's it. Enjoy. These exercises will be extremely beneficial in helping the prevention of carpal tunnel syndrome.